All right, so hi, I'm Casey Glass. I am the ultrasound curriculum coordinator at Wake Forest School of Medicine in North Carolina. And we had the third year curriculum. And so we also had an assistant dean in our group who helped bring some of the institutional concerns into our discussion. So in terms of problem identification, we started out trying to frame our discussions in the context of implementing ultrasound on clinical rotations wherever that would be practical and appropriate. A lot of the main barriers there have to do with tradition and the traditional third-year curriculum, which involves, rotating clinical assignments between the specialties. Another big issue is just finding enough clinical instructors or ultrasound champions in those places where the students rotate that responsibility would not come back to the ultrasound curriculum director to have to kind of every month go ahead and redo this curriculum. In general, most of subspecialty faculty do not use a lot of point-of-care ultrasound, even in specialties where its use is pretty regular. The other issue brought up by our former student in our group was that, if this is not on the shelf, if there's not some sort of assessment component, it's hard to get traction with the students as far as spending their time there. And then lastly, just the availability of machines at clinical sites, and then the need for some protected time for the people who are doing the teaching so that they have the space in their day to do that. In terms of assessing the learners, one of the things that came up was talking to the administration about where the curriculum holes are in that third year curriculum. What does the institution need in terms of improving certain rotations, improving contact time with attending physicians, improving small group time, what is the need there? In terms of our discussion as kind of ultrasound experts looking at third year students, one of the things we came up with was that often they need to know when is the appropriate time to do an ultrasound. So like what we just saw in the second year slides, kind of what is the appropriate indications, what are the actual test characteristics of the studies that we do, and then overall just to be able to learn the appropriate clinical exams. And so the things that we decided were pretty easy, low-hanging fruit for a third-year curriculum were things like ultrasound-guided vascular access, specifically peripheral access, bladder scans, on the surgery rotation, fast exam or gallbladder, an OBGYN, kind of a second, third trimester evaluation of fetal presentation, placental location, AFI, fetal cardiac activity, and then in the first trimester, just assessing the location of pregnancy. Internal medicine, we had some discussion about this, but we felt that in most cases the rush protocol, even for kind of a general floor assignment, would be useful. So for those nighttime on-call emergencies and things like that, that would be a useful protocol to know. And then lastly, pediatrics, we talked about just kind of assessing a child for dehydration and then doing bladder assessments prior to a cath UA test so that we could hopefully more successful. Again, one of our main goals was to develop some sort of implementation where we would not have to bring students back to home base to do some sort of educational intervention every rotation. In the first and second year, having them in one place is fairly easy. For an ultrasound director to do that in the third and fourth years requires a lot of time and many different days to be available to do that. So our strategies involved similar strategies to what we've already talked about, lots of online modules and podcasts, definitely identifying some sort of on-service ultrasound champion who can be responsible for making sure that ultrasound component is implemented on that rotation, whether or not they independently do that. They are responsible for kind of making sure that it happens. And then the use of simulation for teaching and assessment, and then online supplementation with quizzes or other assessment tools. The biggest challenge is really kind of implementing the third year curriculum because of the variety of clinical sites and the variety of practice settings that students go to. And so taking up the idea of communities of practice, kind of building a society in your institution around point-of-care ultrasound that involves multiple specialties, where you can have a variety of providers who cover maybe the same content areas and can be available to teach these things is very helpful. The other thing is just talking about spreading out the material, making sure that it doesn't get batched in one particular part of the third year, so as we can have reinforced interval reinforcement of the ultrasound teaching. and then again, simulation. And then one of the big challenges for implementation is to try to maintain some sort of consistency in the experience when you have multiple clinical sites. How do you do that? That is a challenge, but also something that definitely needs to be addressed at the time of implementation. And then evaluation and feedback was something that we talked quite a bit about, and is fairly challenging. We talked about, hopefully eventually the shelf exams will change to incorporate ultrasound. Certainly there can be some assessment with peer-to-peer teaching on the wards, and then instructor feedback at the time of the exam. We discussed using milestones for kind of continuation, a spectrum of assessment over the third year. OSCE certainly we've already talked about. And then also this idea of portfolio development. One of the challenges we talked about was if students are generating all these images on the clinical rotations, how would one find enough time to really look at all those images, give feedback image by image? It is quite a time commitment. So having the students kind of curate their own best of list for you to kind of look at as a product of that rotation would be one way to kind of be able to give them some feedback in a more time-conscious fashion. And that was it for us.